Hey guys, welcome to my channel, Nurse K Explains, and today we're going to be talking about how to study with your textbook. Yes, how to study with your textbook. I know it sounds simple, and I know you may think you have it down, but trust me, a lot of nursing students are not studying with their textbook effectively. This is a mistake that a lot of people make, okay? Have you ever sat next to someone and you see them highlighting every line in their textbook word for word, and by the end of the lecture, they literally have the entire 200-page chapter highlighted? Is that you? And if it is, don't feel bad, because here we're going to learn how to not make those mistakes, okay? Or you might be the person not doing so well on your exams. And this is why we're going to learn how to effectively study with our textbook. Up until now, you have been taught to memorize your content, okay? And this is like a 18-year habit that we have been taught from grade school on up, even in our prerequisite college courses for nursing, right? How you test for a World Seal is totally different from how you will test for a nursing course, because in nursing, we are taught how to answer the questions correctly based on a nurse's judgment, okay? This is what the NCLEX is going to test you on, your judgment. Are you going to do the things that a prudent nurse would do, okay, at your level, at your baseline? That's why a lot of students find it difficult in nursing school to progress through the program. And this is why the textbook is so important. It's important to learn how to effectively use it, because a lot of people are using it wrong. So to help us do this, we will be using revision templates. And you may have heard this term in another term, such as like a concept map or a body page, but I'm gonna put it side by side so we can review this together. So basically what you're gonna do is, for each disease process, you're gonna pull from your textbook where applicable and put it in these boxes here, okay? Before we get into the revision template, let's talk about the upkeep. You are going to need this, okay, throughout nursing school. The mistake y'all be making is y'all be trying to get that quick cash and resell those textbooks. Y'all be so happy to go on to the next level that y'all be throwing away those old notes. No, do not do that. You are going to need this for your exit exam, the comprehensive exam at the end of your nursing school journey, as well as your NCLEX. The best way to keep up with these revision templates is to put them in a binder. Get you a hole puncher, punch holes in this bad boy, and put it in a binder, and keep that binder, okay, for your exit exam as well as your NCLEX. So this revision template is going to have the notes from your textbook as well as the notes from your lecture on it, okay? So just keep up with this. For every disease process, you're going to do this revision template, and this is how you pull from your textbook, and that's what we're going to go over now. So at the top of the page, you have your textbook and your page number. So this is just like a reference guide. It's like your bookmark. So just in case you may have missed something, or you want to add something onto it later when you doing your final exam, that way it's just an easy find for you, as well as your lesson. That's typically what's on the syllabus. Just like I said, just as a bookmark for you. Next, underneath that box, you have your disease. So for instance, if we're going to do diabetes type 2, that's what you're right there. And underneath that, you have your pathophysiology and etiology. So this is, describing the disease process itself, the patho of it, as well as like the etiology, the predisposing factors. Who are you more likely to see this disease process in? What are the risk factors? Is this people who are obese? Are they over a certain age? Is it genetic? What causes diabetes type 2? Remember, there's a difference between type 1 and type 2. Is the pancreas working a little bit, or is it not working at all? Are you producing any insulin? So that's what you're going to put there in that box, okay? The next box we have is our signs and symptoms, as well as our complications. Okay, very, very important box, because remember, we're not memorizing content itself. We need to know how to apply our knowledge. So this revision template is good because it's going to teach you how to apply your knowledge, and it has everything on one page. It's a one-stop shop, okay? So signs, symptoms, and complications, very important. So again, if we're doing diabetes type 2, this is where you're going to list your frequent urination, your blurred vision, your poor wound healing, as well as your complications or the complications of diabetes. Very important. This is where you're going to list your DKA. You can also, list a little side note about DKA in there as well in that box. This is also where you're going to list, your retinopathy, your neuropathy, things like that. Let's go down to medications, diagnostics, and labs. Honey, now diabetes type 2, y'all know there's so many medications that you will give. Lord Jesus, you're gonna need your whole pharmacology card for this section. I don't know if this little box is gonna be enough for you for this particular disease. However, you can list the main things in there. Their classes of medications you would give, the most frequent ones that you would give, as well as your diagnosis. How is diabetes type 2 diagnosed? We're gonna do our hemoglobin A1C, right? Also, your labs. What kind of labs you're going to see is the doctor going to order for these patients for the diagnostics as well as management of these patients. Like I said, we're going to look at hemoglobin A1C, your glucose, your potassium, renal functions, things like that, as well as our nurse management. How are we going to manage our diabetic type 2 patients? This is where a bulk of our, test questions are testing us over. However, remember, our test questions are going to have clues in them, which most likely pulls from the signs and symptoms, the medications, the labs. So that's why this revision template is so useful because, like I said before, it's a one-stop shop. So the way a test question is usually written is they'll give you some signs and symptoms. They won't tell you what it is. You got to figure it out from the signs and symptoms that are listed, or they may list, a couple labs on there. Like I said, they want you to figure out what's going on with the patient, and then they want you to manage that patient based on what you figured out from the clues that they put in there. So your nurse management. Are you going to check blood sugars, before meals and at bedtime? Are you going to, put them on a specific diet, a carb-consistent diet? Are you going to have them do a log of their blood sugars if they're new diabetic? What kind of education are you going to give them if they are a newly diagnosed diabetic? Things like that. But that's not it. Well, we got a back page too, y'all. Let's go to that. So on the back. So this is why it's important if you are going to use these revision templates. Look at your syllabus. Remember, it's, I would say 50, maybe not that much. 30% of nursing school is about being organized. When you look at your syllabus for what you're going to review for that week, go ahead and write out on your revision templates each disease process that that y'all are going to be, reviewing for lecture. And then that way you can always just bring it to class, and on the back, even though you might not have the front page filled out from your textbook, at least you'll have this page already, in your course, and you can just start writing down when you're in your lecture hall. So this is the notes that you will get from lecture. And also, you can also fill in them front boxes from your lecture too if they apply. But I recommend just putting all your lecture notes, here. We also have underneath that box is your mnemonics. Those are things that help you remember that disease process. Also, a good resource for nursing school is the memory books. It's like these cute little memory books that have pictures of the disease process, and they put the signs and symptoms on there, and they kind of like acting it out. So if you want to draw like one of those pictures in that box, that'll be great. The next box under that is your clinical experience. A lot of times, clinical helps us connect the dots, which is why we have clinical practicum in nursing school. So many times we memorize things by actually seeing it. So if you have a patient in clinical that's a diabetic and you remember that they were on, an insulin drip, then you will go ahead and you can write that there, like, patient A was on an insulin drip. This is what we did. It'll help you connect those dots, you know what I'm saying? And then underneath that is an empty box, which you can just put anything in there, just some extra notes. Remember how I was talking about on the front page, how, diabetics, there's so many medications. You can put some of those extra medications in that box there. Just anything that you have to add on, just some extra space for you. For the most part, each disease process will require 1 page. You may need 2. It's important, like I said, if you don't want to have all this paper to print them out, front and back, go ahead and go to your library, print out front and back copies, so that way everything's just on 1 page for each disease. And remember, like I said, you want to keep up with these, okay? They're great resources to use in the future when you test for your exit exam as well as your NCLEX. If you would like this is free. I have this on my website. I also put the link below. So if you would like this revision template, like I said, there are others out there. You don't have to use this one, but I do recommend using something like this while you're in nursing school. This is an effective way to study with your textbook. It keeps everything organized, keeps everything on 1 page. It helps with those people who are visual learners. Everything's on, it's a one-stop shop. If you gain value from this video and anything I shared here, make sure you like, comment, and subscribe. Here to help you all become great nurses. So we're on this journey together to help you successfully matriculate through your program, pass your NCLEX, get out there on that floor and get this money, okay, y'all?